Hi there, my name is Gordon and I'm a pediatric physical therapist. Today I'm going to show you how to correct a right side torticollis. So torticollis occurs when there's a muscle on the side of your baby's neck called the sternocleidomastoid muscle, and sometimes that muscle gets too tight and so your baby will have a tilt to one side and a rotation to the opposite side. So torticollis is named for the tilt. So if your baby has a tilt to the right side, then your baby has a right side torticollis. If your baby's head is tilted to the left side, your baby has a left side torticollis. Now, how does torticollis happen? A lot of times, babies get cramped in utero and they might be in one position, not moving around a lot, and wind up with their body stuck in like one position. And so when they're born, they tend to have their head tilted to one side. You'll notice that the baby's head is tilted to one side but rotated to in the opposite direction. So what I'm going to do today is I'm going to show you how to identify the torticollis, how to do a simple stretch for the tilt, and it's not a stretch for the rotation. So like I said before, you want to look at your baby, look at a couple of pictures that you've taken recently, and if you notice that your baby in all of the pictures has their head tilted to one side, then it's possible that your baby may have torticollis and you want to investigate that, ask the pediatrician for a referral, have the pediatrician take a look, examine your baby, and be able to determine if your baby does in fact have torticollis. So let's get into how to stretch your baby for torticollis, right side torticollis. So that is, the baby's head is tilted to the right side and rotated to the opposite side, rotated to the left side. So let's start with the tilt. The stretch that I'm going to show you for the tilt is a stretch. It's one of my favorite stretches. It's called the football hold. The way you do that, we're working with a baby that has a right side torticollis, so the baby's head will be tilted to the right. What you want to do is face your baby away from your body, tread your left hand in between baby's legs like this, bring that arm up and hold the right shoulder down. That's the first phase of this stretch. And I like this position because baby is going to be close to your body. You can hold him and hug him and rock him. The next step, it will be to use your other hand. Some therapists like to hold baby's head and gently tilt the head up this way. That way stretching these muscles, the muscles on the right side of baby's neck that has that bend, the right side torticollis. And if you bring it up gradually, slowly like this, you'll be stretching that muscle. I like to lay baby in my arms and bring my right hand on baby's chest or on baby's hip, and then I can just gradually let baby kind of drop downwards, where, as you can see, baby's already stretching that right side neck muscle. And like I said before, if you are holding your baby like this, you'll be able to tell when baby starts to fuss and whine and where they're getting a little bit uncomfortable. You can rock your baby. You can start talking to him. You can use your hand to play with his hair and comfort him, then put him back in that position. If your baby needs to take a break, you can just move that arm, comfort baby in this position, and then come right back to it. And you can see that that neck is being stretched. Once again, I'm holding the shoulder down, the right shoulder down with my left hand. And so a baby's body weight is what's actually doing the stretching. So that is how to stretch the sternocleidomastoid muscle to try to get rid of that bend. The other thing that we're going to do is work on rotation. So now, bringing baby back up to a vertical position, you will notice that if baby has a right side torticollis, the head will be tilted to the right and rotate it, but rotate it to the left. So what you want to do is position baby to where their cheek is up against your chest. Bring baby facing forward. I like to bring my right hand on, not the jaw. You want to stay away from the jaw. You don't want to do this and be cranking on baby's neck trying to turn it. I like to make my hand as big as possible, hold baby by the head, and just gradually, gently turn the head towards the right, which means you'll be turning the head in the opposite direction from the side that the torticollis is not naturally causing baby's head to be rotated. Remember, if you have a right side torticollis, baby will be looking towards the left side. And so what you want to do is rotate the head. You can rotate the head, turn baby's head slightly, gently towards the right side. And now you're stretching the rotation component of the torticollis. So those are two simple stretches that you can use while you're playing with your baby. With the football hold, you can do this while you're walking around with baby, and baby can be stretching. With this one, I prefer to have this one done while you're sitting. You can rock the baby side to side. You can talk to the baby. You can play with their hair as you're doing this. Anything to keep them calm and comfortable, because that's what you want. You want baby to be calm whenever you're doing any type of stretching. Any type of stretching, you want baby to be calm and not trying to fight you or screaming. If it gets to that point, please stop, okay? So those are two simple stretches you can do if your baby has a right side torticollis. I'm going to make other videos that are going to show some more passive techniques that you can use, some positioning techniques. And I'm also going to make another video showing a left-sided torticollis and how to stretch your baby for that. Okay? That's all for today, my friends. Remember, a hug is a silent I love you. So hug your babies every day, and I'll talk to you soon. Take care.